Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pelvic pain in men. Pelvic pain in men may begin suddenly, as with a kidney stone or a pulled muscle, or it can come on gradually, as with prostatitis or a urinary tract infection, UTI. Other possible causes include, but are not limited to, an inguinal hernia, prostatitis, a bladder infection, or digestive problems. /r/n/r/n If you are a male experiencing pelvic pain, it's important that you see your healthcare provider promptly. While the cause may not be serious, there are other cases when pain can rapidly worsen and even cause long-term complications such as infertility without appropriate treatment. /r/n/r/n This article looks at some of the most common causes of pelvic pain in men. It also discusses how pelvic pain is diagnosed and treated, and when you should see a healthcare provider. /r/n/r/n Pelvic pain affects the lower abdomen or buttocks. Some causes of pelvic pain only affect people with male genitourinary organs and anatomy, while others can affect any person. /r/n/r/n Male pelvic pain can have varying characteristics depending on the cause and its severity. Pain may be very localized or spread throughout a large area. Some describe the pain as dull or sharp, feeling more like pressure, constant or circumstantial, or having other qualities. /r/n/r/n Prostatitis is inflammation of the prostate gland. An infection can cause sudden, or acute, cases. Chronic prostatitis, on the other hand, is usually caused by inflammation, often without an infection. In addition to pelvic pain, prostatitis may cause urinary problems or problems with ejaculation. /r/n/r/n When a bacterial infection is not the cause of prostatitis, the condition is known by several names. These include :r/n/r/n The prostate can enlarge due to /r/n/r/n A large prostate can cause pelvic pain, bladder issues, or it might not cause any symptoms at all. /r/n/r/n A hernia occurs when a body part pushes through the muscle or tissue that normally keeps it in its place. A number of different hernia types affect people with male anatomy, such as /r/n/r/n Male chronic pelvic pain syndrome may be associated with prostatitis or BPH, but the pain can last longer than expected with these conditions. It can even occur without an identifiable cause. /r/n/r/n This is a diagnosis of exclusion, meaning that your healthcare provider will attempt to identify other causes of your symptoms before concluding that they are attributable to male chronic pelvic pain syndrome. /r/n/r/n Testicular torsion can cause severe pelvic pain. While uncommon, it is a medical emergency. Surgical treatment is necessary, and a delay could cause loss of the affected testicle. /r/n/r/n Pelvic pain can also be caused by health issues that affect people of any sex, including /r/n/r/n If you have a chronic condition, such as IBS or recurrent constipation, pelvic pain can recur when your condition acts up. In this type of situation, your healthcare provider may have already prescribed medication for you to use whenever this happens. /r/n/r/n But if you develop new or worsening pelvic pain, you should see a healthcare provider. Associated issues that signal that your pelvic pain could be caused by a serious issue include /r/n/r/n If you have severe pelvic pain and any of these symptoms of testicular torsion, seek immediate medical attention /r/n/r/n Your medical evaluation will include a history and physical examination. You may also need a blood test, urinalysis, UA, and/or imaging. /r/n/r/n During your medical history, your healthcare provider will ask for details about your pain, including /r/n/r/n As part of your physical examination, your healthcare provider will look at and around the areas where you have pain. Your physical examination will include palpation, touching and gentle pressure, in the area of your pain. A hernia can usually be identified on a physical examination. /r/n/r/n Depending on your symptoms, you might also have a prostate examination, which involves a digital rectal examination, DRE. /r/n/r/n If there is a concern that you could have a bladder infection or inflammation of the bladder, your healthcare provider may order a urinalysis to evaluate your urine for evidence of infection or a tumor. /r/n/r/n You might also need to have a blood test to see if there are signs of an infection, especially if there is concern about appendicitis. A blood test can also be used to detect prostate-specific antigen, PSA, which may indicate prostate cancer. However, the results of a PSA test do not necessarily rule prostate cancer in or out. /r/n/r/n Imaging tests can include /r/n/r/n These tests may detect signs of /r/n/r/n Your treatment depends on the cause of your pelvic pain. You might need pain control as well as management of your underlying medical issue. /r/n/r/n Each cause of pelvic pain requires its own approach. For example, antibiotics are needed if you have a bacterial infection. Kidney stones may be treated by drinking lots of fluids, or with lithotripsy or surgical removal if necessary. Tumors may require surgery, chemotherapy, or radiation. /r/n/r/n Physical therapy has been used to manage different causes of male pelvic pain, including chronic pelvic pain syndrome and pelvic pain after a prostatectomy. /r/n/r/n Common treatments used for managing pelvic pain include /r/n/r/n Other treatments used in the management of chronic pelvic pain syndrome include acupuncture, prostatic massage, and impulse wave therapy. /r/n/r/n Sometimes it is not possible to avoid pelvic pain, but there are some approaches that can help reduce your chances of developing it. /r/n/r/n Male pelvic pain can have many possible causes. Some common causes of pelvic pain in men include prostatitis, enlarged prostate, and hernias. Less common causes include testicular torsion and certain kinds of cancer. /r/n/r/n See a healthcare provider anytime you have new pelvic pain. Lab tests and imaging tests can help your healthcare provider confirm a diagnosis. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.